Hello, and welcome to Nursing Sensitive Quality Indicators. My name is Megan Butler from Capella University for class Nursing Flex 4040. According to Bellick from Texas State University, the National Database of Nursing Sensitive Quality Indicators, known as NDNQI, was established in 1998 by the American Nurses Association for Safety and Quality Initiative. NDNQI is a proven quality improvement tool used to monitor and benchmark nurse sensitive patient outcomes and RN workforce engagement within acute and ambulatory care settings. Nursing sensitive quality indicators measure certain factors that influence nursing quality of care and patient outcomes. The provision of outcomes oriented, cost effective healthcare is no longer a goal, it's a mandate, stated Gallagher and Roll 2003. Quality indicators are important to help improve nursing standards and ensure increased patient outcomes. In my tutorial, I will discuss pressure ulcers, rates in home care, and the process nursing use to improve patient outcomes. Outpatient settings are becoming increasingly important as healthcare systems in the world aim to reduce the cost and improve the quality of care. In 2017, 3.4 million Medicare beneficiaries used some form of home health care. In home care, wound infections are one of the main reasons for hospitalizations and treatment to be so costly and can be burdensome to patients and their families, stated Who and al. 2022. I interviewed Katie Peterson, Master's in Nursing certified nurse practitioner and also the administrator of LB Home Care. She is also my boss as I work at LB Home Care. She has gained a lot of knowledge in working with home health due to being employed for over 10 years. Katie has not just worked hands in hands with patients, working as a case manager, but she also has a role at the home health care as an administrator for over 2 years. Katie is familiar with collecting data and entering it into the database as she collects outcome and assessment information sets per OASIS. Data and transfers it into the Center for Medicare Services through a third-party web-based system called Internet Quality Improvement and Evaluation System, IQIES. She also does patient satisfaction surveys through strategic health providers and uses OASIS data from patient-driven services and payment. The challenges she has faced is having to learn and operate all third-party programs by herself, learning how to rectify rejected documentations, staff quarterly meetings, and through QAPI that is mandated by the Center of Medicare Services, CMS. Each staff member gets a printout of how well they are doing through the documentation of OASIS submitted, and individual learning opportunities are performed. When documents are frequently rejected by the CMS, Katie, the clinical manager, case managers, and therapies meet every Wednesday to discuss Medicare patients. This helps increase awareness within the team of any challenges or changes each other may have had with the patient. With this collaboration, the team can discuss solutions or feedback regarding a patient. Frontline staff, such as RN case managers, use OASIS data collected from their patient's assessment. Though OASIS is generated during the initial evaluation of the patient, recertifications that is done every 60 days, and resumption of care when patients have been in the hospital, and discharges. The one problem with collecting data with the OASIS is nurses write a narrative about the visit and go more in depth, which causes loss of data due to the narrative transfer not being uploaded and all information is not gathered. Katie has also had issues receiving payments within an adequate time frame. This can be from transferring the data within the third-party web base CMS being behind reviewing OASIS, and due to other payment issues within the company. While the RN case managers assess a patient at the initial visit using the OASIS, they gather a whole system of data, including pressure ulcer assessments. Each patient within the assessment is rated using the Braden scale that shows how high a patient is at risk to develop pressure ulcers. It also discusses pressure ulcers due to mobility, nutrition, whether they have a current surgical wound or pressure ulcer. While conducting the OASIS, it also gathers data regarding a patient's current pressure ulcer stage. Pressure ulcers are staged between 1 and 4. Stage 4 consists of total loss of tissue or complete eschar of the wound. Within each visit for the wound or pressure ulcers are addressed, and nurses take weekly measurements of the wound and describe the wound bed, the tissue around the wound, how much drainage and the type of drainage, if there is an odor, whether a wound has improved or declined. After this assessment, the case manager describes the change of dressing and lists the type of dressing materials used. The case manager also updates care plan with dressing change per plan of care for fellow RNs to know how to manage the dressing and how often the physician has ordered the dressing changed. The RN will fax the physician with the status of wound pressure ulcer and request the patient to be seen at wound care at Lake Region Hospital for debridement or further direction to take if wound persists or has eschar. Wound care will update orders if there is a new dressing to use, measurement of the wound, if the wound was debrided, and how often to change the dressing. Home care is also able to manage a wound vac machine if needed for pressure ulcers and other types of wound. The interdisciplinary team of nurses from the home health care, physician, and wound department ensure the best patient outcome provided for the patient with specialty area to ensure wound healing. Next, I will discuss collection and distribution of quality indicator data. Quality care varies between organizations and even units within an organization. Inadequate care can be harmful financial and social consequences. No social meal infections, length hospital stays, or even death per Rapin J and Alt 2022. After reviewing the data collection in my interview and other resources, home healthcare providers such as LB Homes collect information regarding pressure ulcers and patient's wound at the start of care, OASIS, and discharge OASIS. This data can be disseminated by Medicare and other clinical studies as the information entered is uniform in structure. Once the OASIS is completed, the nurse visits is not uniform as most documentation generated is in the nurse's narrative. This can give a more in-depth subjective data collection by the skilled nurse. This data does not get transferred into a specific database, and the information is missing when looking into statistics of pressure ulcer and data collections through home health care agencies. Wounds being one of the major causes of home health care's patient assessments at the emergency department and hospitalizations. More common patients associated with PVD, diabetes, and skin ulcers had an increased wound documentation in parent records, stated WHO and ALT 2022. There are diverse patient population in their home. Home care nurses believe time, high productivity requirements, pay per visit compensation, documentation burdens, EMR systems are barriers to high quality home health nursing. Medicare was perceived as contributing to the barriers with burdensome documentation requirements and regulations that impeded holistic patient-centered care. Nursing participants indicated that the effects of these barriers when nurses are stressed, burnout, morale distress, and intent to leave, lower patients' outcome and satisfaction, and healthcare disparities, states Narayan MC 2024. Conclusion: while looking at this data, home care is lacking the narrative portion in documentation to look at a wound as a whole. LB Home Care uses satisfaction surveys and meetings on Wednesdays to help discuss and treat wounds and increase patient-centered care. Thank you for your time with my assessment.